The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. On today's show, we'll be talking about Medicare, particularly the open enrollment period. Once a year, during a narrow time window, you're able to evaluate how is your Medicare plan meeting your needs. Is there a better plan out there, or do you maybe need to go to a lower plan? It all depends on what's happened this year, but we've got an expert to talk about it, so stay tuned. We'll be right back.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Receiving help for Ella has been life-changing, and the best word for it is relief. I was the therapist, I was the aide, and I couldn't be the mom because emotionally you're just to your wits' end, you're trying to survive.
I provide care for the Harrises, specifically their daughter Ella. Respite care is extremely challenging, but the rewards that you receive from it are 100 times more than working with a child that doesn't have special needs. Once they get something, it's everything. It's a you celebrate. You don't just enjoy those moments. You celebrate every moment that you get, that you guided them to that next step.
Respite. It's okay to need it. It's okay to want it. Will you provide it? Call 800-224-6034 or visit respite.mt.gov.
It went from survival to enjoying life and being able to be a mom again.
Brought to you by the Montana Broadcasters and this station.
Hi folks, and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services Senior and Long-Term Care Division. I'm your host, Brian Lamore. We're about a month out from open enrollment for Medicare. If you're on Medicare, once a year you're able to evaluate your plan and decide if it is meeting your needs or possibly another plan might help out. Of course, we have an excellent guest here with us today to talk about it. We're talking to Murray Lou McElvey. Ben, welcome to the show.
Thank you. Good morning. It's really good to be here with you. How are you today?
Hey, I'm doing good. You're with Area Agency 2 on Aging, and you're the SHIP coordinator, so you know a lot of things about Medicare. But now, starting October 15th, we can start deciding whether or not to change our Medicare plan, or to keep with our plan too. But there's a lot of things we need to consider. What is open enrollment, and why is it important for a Medicare beneficiary to evaluate their plans?
Well, I'd say that it's one of my favorite times of year because I get to see a lot of people during that time and encourage them in taking a look at their Medicare plans. And of course, now is the time of year that whenever I'm visiting a senior center or just talking to folks out there, when they approach me about what they should do about their Medicare plans, I really encourage them to think about what the last year has been like if they're on a Medicare Advantage plan. Is it something that they've found confusion with or problems with or had claims denied? This sort of thing is going to be one of those considerations, one of the many considerations when looking at the open enrollment time period, which runs between October 15th and December 7th. And folks are invited into our office. We send out letters and let them know that this is a time that they can look at either traditional Medicare or Medicare Advantage plans. If they're not happy with their Medicare Advantage plan, do they want a different one? sometimes within the same family of plans, like Humana has different plans, United has different plans. They can look at that as well as making sure that their prescription plan is going to either remain the same, all of their medications are covered, what their cost is going to be, and whether or not that's going to meet their needs. And so that is why it is so important every year. I meet people who are paying a $75 premium every single month for Medicare Advantage or Medicare Part D plans, and the plans have changed over the years, and that's how I know they've never come to visit us at Area 2 Agency on Aging to talk about their Part D plan, because Part D plans have come down considerably over the years. There's a lot of competition out there to get enrollment numbers up, but there's also the insurance and assurance that you're going to have your medications covered. And that's the time of year to do it, is during that October to December time period. And we do encourage people to fill out the paperwork we send them, which is basically, what's your name, address, phone number, has anything changed? What is your list of medications? Are they currently being covered? How often are you taking them? Have you gone off any medications? Those type of things with their medication list help us look at their plan in the plan finder, the Medicare plan finder, and see if we can either compare a cost savings for them or find out if all those medications are going to be covered again. And then, of course, making sure that if they're on a Medicare Advantage plan, that too is staying the same, and that they've continued to get high ratings, high enough to stay within the state of Montana. I love that Montana has all these guidelines. I love to tell people that Tom Selleck isn't lying to you when he's telling you about a plan. It's just that his plan isn't covered in Montana. So don't dial that 1-800 number that you see Tom Selleck or Captain Kirk talking about their Medicare Advantage, because we don't have those plans in our state, and a lot of it has to do with our population numbers. So the plans we have are much more limiting as far as the companies that we have, but it does make it easier in the choices that we have. And of course, we want to make sure people's providers are still going to be covered by their plan, because that would be an awful thing to find out January 1st, 2025, that your primary or your specialist is no longer in your plan. So
Now, Mary Lou, you're a SHIP coordinator, State Health Insurance and Assistance Program. Tell us about the SHIP people. You're the ones that help individuals with Medicare, but what's your job and how do you meet that need?
Oh my goodness. Do we have enough time?
Yeah.
As a SHIP coordinator, I basically encourage the other SHIP counselors around the state in my area, which is 11 counties and 2 Indian reservations. We have many SHIP counselors that are in the smaller communities to help their beneficiaries, the Medicare beneficiaries, to make sure that they understand what their plans are, as well as maybe assist them with calls to Social Security when it's time to turn on Social Security or when it's time to turn on Medicare. And that's the first call we want to make for people turning 65, or if there's somebody with a disability who has run that 18 months of Medicaid and now it's time to go on Medicare, help them understand what that means to them and getting set up on a Part D plan. And so we are continuously busy presenting what it is that we do as SHIP coordinators to the communities that we live in, and making sure that people know how to get a hold of us and when to get a hold of us. And we're information and resource specialists, so we send people to the areas. Like we are on the receiving end of the 1-800 number for a SHIP counselor. And so we at Area 2 Agency on Aging, we are in Roundup. So if somebody calls me from Carbon-Stillwater, they're actually going to be referred to another SHIP counselor in that area, because of course they may want to go in and see somebody in person, and I'm an awful long drive from Joliet or Belfry or anything like that. So we like to have people call us and have us find out where they can get the best service in their area.
Yeah. Well, Mary Lou, we're drawing to a quick conclusion of our first segment, but I know our SHIP people are throughout the state. They're there to help you out with anything that involves Medicare, Social Security, but they have access to other programs that are available to seniors. We'll talk about that and so much more in our next segment, so stay tuned. You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Today, class, we'll be discussing the term ombudsman, a word we borrowed from the Swedes and never gave back. Say you're a resident or you have a loved one in long-term care. Now, what do you do if you're not happy with the care and services you receive? You call your long-term care ombudsman, of course. Your ombudsman is available to support you and your rights. An advocate on your behalf could be the ticket. This is your home. If you have questions, the numbers right there below me have all the answers. Class dismissed.
I was diagnosed with diabetes in 1992, and I went into denial. It made me angry. I was a professional chef, and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
A message from FireSafe Montana. At FireSafe Montana, we have years of experience working with effective forest management plans. Planning is a key part of creating a healthy forest and being able to manage wildland fire. Which do you think looks better, this or this, where a well-designed fuel reduction plan was implemented? We can help you design a workable mitigation plan. This message brought to you by FireSafe Montana and aired by the Montana Broadcasters Association.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and continuing our discussion about Medicare. We have open enrollment happening soon. It'll be from October 15th through December 7th, and that's the time period you can evaluate your Medicare plan and how it's meeting your needs or not. Now, rejoining us is Murray Liu of McIlvaine. You're the Area Agency 2 SHIP coordinator, and we'll be getting a booklet that we get every year when you're on Medicare. It's Medicare and You. And that Medicare and You book is a pretty important book, isn't it? Can you tell us more about what it is and why it's important?
I sure can, Brian. I'll tell you what, it is one of the best resources that I think people get about their Medicare. Even if you're on a Medicare Advantage plan, it explains, it's like the dictionary of what Medicare is. And some people find that it's overwhelming, but really there are just a few pages that I want to talk about, because in the beginning of it, it has an appendix that's going to tell you if you need to see an orthopedic, if you need to see an ophthalmologist, if you need to see an elbow doctor, back to the orthopedic, which seems to be a big one, you're going to be able to look that up, go to that page, and it's going to tell you what is included in Medicare. The thing to know is that with Medicare and Medicare Advantage plans you do need to get many times prior approval. And so it's important to read your Humana or your United or whoever you have, read those guidelines and find that out before you just go to any doctor. But with Medicare, the Medicare and You book, I read it during a snowstorm, took several naps in between, but it did show to me the importance of being able to look at what kind of diagnosis is going to be covered. My favorite example is that Botox is covered when prescribed by a neurologist for migraines. It is not covered when I want to make my forehead look beautiful. That is not a Medicare expense. And so there are just certain things that you want to know, is this covered by Medicare? Because whether you have a supplement or a Medicare Advantage plans, knowing the difference is important, and knowing that it's covered by Medicare. Because if Medicare covers it, then other complementary expenses may be covered within that Medicare plan, but you want to know that, and that Medicare and You book can explain that. It can also explain what the difference is between your Humana plan that you currently have, which is listed on the front of your Medicare Advantage card, for whoever it's from, and other plans within that same company. So say you hear that somebody is getting a $75 grocery card. How do you qualify for that? Well, first of all, it's income based, so you may not qualify for it, but it's always worth asking, and it may be just within another plan within, say, Humana. That's explained in that Medicare and You book. The Medicare and You book also talks to you about supplements. There's one page that is a diagram of what different supplements are. The important thing to know is that a G is a G is a G. No matter where you buy it from, it's important to price shop, but a Plan G is always going to be a Plan G, and the only difference is the cost. And so make sure that if you have a favorite insurance person you go to talk to about a supplement or a Medicare Advantage plan, that's great. But after they give you the price, you may want to call across the street and check too, because truly it could be the difference of $60 to $80 a month. And as time goes by, those costs on supplements do go up. So you want to know the difference. Those are explained as far as the differences between a Medicare Advantage plan and a supplement. Those are explained in that Medicare and You book. So again, I find it to be a fascinating book, a good book. The reason they send it out every year is that the plans do change. What gets covered is changing. There are additions to deductibles and premiums. So it's just a good book to have. It's not a coffee table book. I don't want it laying out for the guests to see, but you really do want to take a look at that when you get it.
Right. And what complements the book is there's a website, a Medicare website that has plans that are available in Montana, and they can do some comparisons. Tell us more about that site, please.
So are we talking about the Medicare.gov?
Yes. Mm-hmm. That will compare plans that are available.
Website. Mm-hmm. And I am somebody who I can help other people at my desk, in my office, in Walmart. If they ask me a question, I can help them. I go home, and if I have to do it for myself, I completely freak out. It's like my brain is left at the office. I would say that Medicare.gov is one of the nicest and easiest websites I've ever worked on. And what you have to do is make a username and a password, and then pick your favorite vacation spot. I recommend making whatever your answer is be your hometown or something, because you won't forget. But I've had people give me Puerto Vallarta and Cabo San Lucas, and the answer is Mexico, and then we can't get into your Medicare.gov account. But that Medicare.gov website is a great website to be able to compare plans, look at drug plans that are out there, and make sure you put in all of your medications, how often you take them, or what the prescribed amount is, the dosages, and then it will tell you whether or not they're covered and whether or not they're covered at the pharmacy you're currently using. So that's a really important piece of that, is to make sure you're getting the coverage that you need.
Mm-hmm. And I think what's important too is our SHIP counselors. Once you do all this, you become informed. You're able to ask better questions of the SHIP counselors. And they don't have anything on the shelf to sell you, do they?
No, we are not selling anything, and we don't charge anything for our services. And I love that about my job, because it gives the beneficiaries the opportunity to feel free to ask questions that they may not ask if they feel like they're going to be pressured in one direction or the other. And then as a SHIP counselor, it gives me the freedom to basically speak freely about whatever it is they're asking without some sort of bias one way or the other towards a certain plan or anything like that.
Well,
no commissions.
No conditions. We've gone quickly to close on this segment, and we've got a lot more great information. And next, we'll kind of focus on scams. People are out there, want to take your money. Be aware.
Yes.
Stay tuned.
Sergeant Jones. Please respond. I was separated from my squad. Requesting backup. Anyone? Please respond. I'm all alone here.
This October, author, scientist, and autism advocate Temple Grandin and Grammy Award-winning musician and anti-bullying activist Daryl J. Williams are coming to Butte for the Putting It All Together conference. 3 days of up-to-the-minute information for individuals with developmental disabilities and their families, plus an inspiring evening talk by Temple Grandin. Registration for the conference and admission to Temple Grandin's talk is free, but register early to ensure accommodations. Go to puttingitalltogetherconference.org for more information.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
It's been 27 years. I never thought I'd still be smoking, but here I am, COPD and all. I'm about to have a granddaughter. There's so much to show her, but I'm scared I won't be able to keep up like I used to. I kind of gave up on myself on quitting. But it's different now. I want to be here for her and for my daughter.
Hi folks, welcome back to Aging Horizons. I'm your host, Brian Lamore, and we continue a discussion about Medicare and the window that you have to evaluate the programs that you're on or that you could choose to be on. It's from October 15th to December 7th, and please don't wait till the 7th. I mean, so many people are swamping our operators who are standing by. But rejoining us now is Mary Lou McIlvaine. And Mary Lou, let's talk about scams. There's always somebody out there saying, this is too good of a deal, I want to take your money. Tell us more about that.
It's very serious. It's a very big problem for Medicare. In fact, it's $65 billion worth of headache problem for Medicare. And it is everything from medical devices to COVID testing to DNA swabbing and catheters, things like that they get slid in, if that's the proper grammar, to your Medicare bill somehow by a nefarious character who is wanting to bilk the system. And they have somehow obtained your Medicare number and or your Social Security number along with that Medicare number, and now they're using it to bill Medicare. Now you may think, well, it was just $92 in catheters that showed up at your door. Don't know what you're going to do with them. It's no big deal, but it is a big deal. It is, as I said, $65 billion worth of a big deal. And if we all were to contribute and all put in there and look for errors and look for fraud, it's not always fraud. Sometimes it's a coding error. Now with traveling doctors, those traveling doctors may be out of Richland, Texas, and you get a bill from the hospital 3 months after you've been. First of all, this is why I encourage everybody to have a Senior Medicare Patrol journal that I give out, that we have available to our clients to record their doctor's visits. And you don't have to get very detailed. You could just put December 5th, 2023, and went to the orthopedic for an injection in my knee. So when catheters show up at your door related to a December 5th, 2023 appointment, that's odd. And that should be reported. So first thing you want to do, of course, is call your doctor's office and tell them about it. And they may say, well, we didn't do that. Then you want to call my office, because then I want to report it as fraud. And I want to know who the company is that sent them to you, what date they sent them to you, how much was charged. And we're going to get it right on up there to the state Senior Medicare Patrol office, as well as the Office of Inspector General, which is the OIG. And they're going to look into it, because if they're doing it to you, they're probably doing it to thousands of other people, which is how we get up into that 65B number, which is not a good number. And scams, if you don't know who's calling you, first of all, Medicare and Social Security will never call you and ask you for your information, ever. If you get a call and you don't recognize the number, do not answer your phone. I know it seems like it's not polite to not answer your phone, especially for some of our older folks that were raised with a phone connected to the wall with a long landline, that they could walk around the house and talk. And a lot of people feel lonely, so they answer their phone. But a lot of times they easily give out that information, and next thing you know, that number is sold as a live number, and they're getting 10 to 12 phone calls a day. You know why I don't get any scam calls? I don't answer my phone when I don't recognize the number.
Right. Well, you know,
I don't respond to texts either.
You know, recently a doctor in Whitefish, his portion of a national scam was $39 million, and he was a small part of it. $39 million in his pocket. It's like, wow. It's amazing. But now let's kind of shift the conversation here a little bit, that we have some programs that will assist an individual to be on Medicare or help pay some of their premiums or some of their expenses. Tell us more about what we call helping programs.
Exactly. Those are called Medicare Savings Programs, MSPs, different than SMP, for your Medicare Patrol. MSPs are designed to help people who are above the poverty line but are still living in a very low income category. And so they can qualify for what is QMB, Qualified Medicare Beneficiary, which it means you truly are just above the poverty line and unable to be on both duly eligible Medicaid and Medicare. And that would be covering your premiums, which is for Medicare, that Part B premium is $174.70. That's quite a big chunk out of your Social Security every month if your Social Security is only $1,200 a month or less. And then Slim B, SLMB, is for a little bit of a higher income, and they cover that premium also. But the difference is that the QMB covers premiums, deductibles, and co-insurances. So therefore, it's not just covering that premium of $174.70. It's covering that $10 office visit or that $45 specialist visit, some medical supplies, things like that. Whereas with Slim B, it's covering that $174.70, and that's what it covers. And then the same with the QI is a higher level. And of course, this is not just for individuals. This can be for a couple or a household, an older couple, husband and wife, getting those benefits, making sure that we can bring them savings if their income meets those guidelines. Mm-hmm. So it's a good program, and those also include the LIS for the low-income savings on prescription medications and the premiums and deductibles for those programs too.
That's great.
So I
Mary Lou,
those.
We're trying to close on our third segment here so quickly, but for our viewers, we want to make sure that we know that the SHIP people can help you out, whether it is a program for helping you pay your premiums, whether you're looking at scams, possible scams, and hey, ask them any question you want. You know, they haven't had a dumb question. And the open enrollment period is October 15th through December 7th. Mary Lou, you've been a great resource for us, and thank you so much for your service to the state of Montana and all our seniors. It's been great having you on. And again, I encourage our viewers, whether it's a loved one or yourself, call our local SHIP person. They're there to help you. For Aging Horizons, I'm Brian Lamore. Thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.